Hello and welcome to Pregnancy Info. Today we will discuss then how to conceive fast, and you have to follow the 33 tips to conceive fast. Children are such a blessing and it's not something to be taken lightly. You might be a planner naturally. You want to know exactly what you should be doing before you get pregnant. This video will definitely learn here today, knowing everything you possibly need to do before you start trying to conceive. Although the list is so long, but we will tell you 33 tips that will help you to become pregnant. But before getting pregnant, you have to do a pre-pregnancy planning. One of the biggest life decisions you will ever make is whether or not you want to have children. Hopefully you and your partner discuss this in length when you were dating or at least during your engagement. This is a big decision of the both of you, in which you can have to an agreement. If you come to the life-changing agreement to have children together, then this video is for you. So let's go into the tips. Number 1. Take prenatal and folic acid before trying to have a baby. Go ahead and start this right away. Taking prenatal vitamins is beneficial for you and your new baby to come. You don't know when you are going to get pregnant, so you might as well start ahead of time with your prenatals. Doctors recommend taking prenatal vitamins before conception so the fetus is nourished right from the start. Doctors recommend taking prenatal vitamins with DHA and plenty of folic acid to prevent spinal defects and other disorders. Another vitamin to ask your doctor about is vitamin D. Number 2. Drink lots of water. It is very important to stay hydrated, but make sure you hydrate yourself with the good stuff, water. You are about to start drinking for 2, so make sure you begin to increase your water intake to 10 glass at least a day. Number 3. Stop drinking alcohol before trying to conceive. This is a great time to stop any form of drinking that might be harmful to your health. Why not start now? No one knows when you might become pregnant, so it's best to be prepared and get your body cleansed from the bad stuff. Number 4. Reduce caffeine intake. Doctors also recommend for you to eliminate caffeine from your diet due to its affecting your fertility. Experts recommend having a daily intake of less than 200 milligrams of caffeine. Number 5. Quit smoking. Just like drinking alcohol, smoking is extremely harmful to your body and your new baby. Some of the major risks, including low birth weight, miscarriage and premature birth, and a growing problem is SIDS, which is more likely to occur in homes of smokers. Number 6. Stop all recreational drugs. If you happen to be taking any, it's imperative that you stop before becoming pregnant due to the adverse effects it will have on a growing fetus. If you are currently taking prescription medicine, call your pharmacist or doctor to see if you need to go off all the medicines while trying to conceive. Number 7. Start an exercise routine. Exercise is, in my opinion, answer to everything. Exercise has so many benefits, I can't even list them all. With all of our medical knowledge in the world, I grant they have not yet found out all the positive benefits of exercise. Establish healthy eating habits. Before conceiving, eat healthy, make healthy decisions, and get in the total mindset of becoming healthy. Your health is far more important now because it's not just about you, but it's about your soon-to-be baby. Number 9. Avoid eating fish high in mercury. Fish is a fabulous source of omega-3 fatty acid, but unfortunately some fish are high in mercury. Mercury can be very harmful to your unborn baby. It's even recommended during pregnancy that women would limit their consumption of all fish. The type of fish high on the list to avoid eating during pregnancy are shark, swordfish, king mackerel, or tilefish, and eat no more than 6 ounces. Number 10. Maintain a healthy weight or track your BMI. Having a healthy weight before conceiving is important for fertility and lower your chances of having gestational diabetes and high blood pressure. Number 11. Watch our playlist named Pregnancy Info, in which you will get all the tips and awareness about pregnancy. It will help you very much to know the knowledge of all the months and weeks of pregnancy. Number 12. Get a physical before trying to have a baby. I think this point is extremely important. Getting a physical now is key to finding out any unknown medical problems you might have that you had no idea you had. Wouldn't you want to find out now instead of when you are pregnant? Number 13. Discuss pre-existing conditions with doctor at your preconceptional visit. Schedule an appointment with your OB-GYN and talk about your pre-existing condition so that you can get that under control now before pregnancy. Anything that you might be dealing with right now should be up for discussion so that you can have better control over your health before you add another human into the mix. Number 14. Genetic screening before trying to have a baby. Are you interested in doing genetic screening before getting pregnant? Some women don't care to do so, but others may think it's really important. This is ultimately you and your partner's decision. Sit down and have a chat about what is right for you and your future together as you move further along with this journey. Since we are on the topic of talking with your partner, here are some other really important topics that you and your partner will want to start talking about in advance. Number 15. Planning out money before getting pregnant. Babies obviously will put a slight spike in your budget, so of course the wise thing to go to make a plan for that expected increase in expenses. Discuss with your partner your financial situation. How are you going to pay for the hospital bills? How are you going to afford the baby's diapers? Where is the money going to come from for the extra supplies that are needed for taking care of the baby? Number 16. Plan your career and work expectations ahead. Along the lines of money comes the topic of our work and career path. Have a chat with your partner about the changes that might take place with work and hours spent at work when baby arrives. Number 17. Have the big discussion with your partner before trying to have a baby. The big question, how many kids do you want to have? Yep, ask him now. Get it all out in the open now so that there are no surprises later on. But just realize that this number could change and that's okay. A lot of discussion will change, but it's good to start the discussion now before baby arrives. Number 18. Plan your home. Usually after getting married, you start planning on where you and your husband are going to live, but when a big change like a new baby comes into your life, house planning is a must. Number 19. Plan for a new car. Your husband is going to like this one. Is it time for an upgrade on your ride? If you think you need more space in the car, consider doing all the research now on which car you want for your growing family, and when you become pregnant, plan to buy the car midway through your pregnancy. Number 20. Catch up on sleep. You really want to get as much shut-eyes as you possibly can before pregnancy. Of course, once baby arrives, you will be awake for most of the hours in the day taking care of your newborn. So enjoy getting good rest now in preparation for the changes that are about to come. 21. Have health insurance. It is highly recommended that you have health insurance in place before having your baby. Without insurance, there can be some high expenses along the way. It's expenses to be admitted to the hospital. It's expenses to be seen every 1 to 2 months by your gynecologist for 9 months. It's expensive to get a breast pump. It's expensive to have an ultrasound. Number 22. Get life insurance. Also, this is a great time to get term life insurance, which is a life insurance plan that is of a certain term. Life insurance is simply insurance for your family or loved ones if you were to die. It's money that is given to your family to help with the income loss from your death. Number 23. Go to the dentist. Having a dental exam is really important prior to pregnancy. It's a good time to get X-ray done before becoming pregnant because it's not recommended to have any radiation exposure through X-ray during pregnancy. Number 24. Mental health screen. Some experts recommend that you have a mental health screen prior to conceiving because women who have mental health problems such as depression prior to conception are more likely to have difficulty conceiving. Figure out your stress remedy. Pregnancy and postpartum recovery can become stressful for some women, as I mentioned earlier. For preventive measures, go ahead and figure out what your best stress remedy is. Being able to manage your stress now will only make it easier when you are hit with a stressful situation when baby arrives. Preventing and avoiding infections. The most obvious infection and disease that is preventable is the flu. If it's a flu season, get your flu shot to decrease your risk of contracting it. 2 other important infections to avoid contracting are listeriosis or toxoplasmosis. Stop your form of birth control. If you are using a form of birth control, you need to do is stop. It's easy as that. There is no wearing or need to plan. It doesn't have to fall on a certain day of your cycle. It's rather simple. All you have to do is stop using it. Figure out when you ovulate. Now that you stopped using birth control, start tracking your cycle and figure out when you ovulate. Get a blank calendar or planner to keep track of your cycle, the symptoms, your mucus discharge, and any other bodily changes that take place over the course of your 32 or 28 cycles. Get your mom's past medical history. Having a long discussion with your mom over a cup of decaf coffee and get to know her a bit more. Find out what her pregnancy was like when she had you. Get a sexual health checkup. I know this can be a hard topic for some, or you might be thinking, I am fine, I don't need to worry about that. But the truth of the matter is most women do need to do concern about STDs. Even if you are not showing signs or symptoms, please take the time to get tested for STDs before getting pregnant. Get a cervical screen. Along the same lines, get a cervical screen as well. Testing for STDs and a cervical screen are two completely different things. Also, most women think a cervical screen is the same as a PAP, but it's not. Cervical screen are done less frequently and are actually a more accurate screen than the PAP. The screen is known for finding HPV. It's ultimately the best way to test the cervical cancer. Make sure that you have the MMR vaccine. The vaccine is highly recommended before getting pregnant because rubella, although rare, can be extremely dangerous to a baby's development while the mom is pregnant with the baby. Rubella is just 1/3 of the vaccine. MMR stands for measles, mumps, and rubella. Bonus tip that you should make a gap of at least 2 years for the next baby if you have a baby before, because the gap is very necessary. If you have had a C-section before, then you must want to be a normal delivery afterwards. So the gap must be given. Hope these all tips will help you to conceive faster and safely. Share this knowledge to the females who are trying to conceive fast. Thank you.